Welcome to Fuller Butz, a behind-the-scenes plastic surgery podcast. Yes, you heard that right. Join your co-hosts, Dr. Sam Fuller and Dr. Dan Butz, board-certified plastic and reconstructive surgeons, on an exclusive full-access pass into the world of plastic surgery. Combining their expertise and training, Doctors Fuller and Butz will share medical insights, detailed explanations, and lighthearted humor to keep you entertained and informed. We're certain you'll become passionate about the plastic surgery specialty, and between debunking myths, uncovering truths, or just making you laugh out loud at their perspective on this creative and artistic field, we've got something for everyone. From tummy tucks to Botox and mommy makeovers to surgery do-overs, the Fuller Butz Podcast will surely satisfy your podcast fix. All right, now let's dive into this episode.
Hello and welcome back to the Fuller Butz Podcast. We have a very exciting episode with a guest on our show. We are welcoming Megan Hagley from Pur Aesthetics here locally at the South Bend, Indiana location in Granger, Indiana. Megan, thanks for joining us today.
Yeah, thank you so much for having me. I'm excited to be here.
So Megan, tell us a little bit about your training, your background, what got you to where you are today and to start Pur by yourself.
Sure. So by training, I am a nurse anesthetist. So I have a bachelor's degree in human biology, did a nursing degree, worked in the ICU for a couple of years, and then did 2.5 years of nurse anesthesia school. Did that for, I've been a nurse anesthetist for over 10 years now. And in 2020, I kind of had an itch to do something a little bit different, just for my family. So I also started at that same time having a little bit of struggle internally where I didn't really realize or recognize who I was when I was looking in the mirror. I've been through a lot of time. I've been through 2 kids and my marriage and work and all the, life stressors. So I started getting my own treatments with toxin filler and hadn't really thought of myself as someone who would do that. I was like, oh, that's a super bougie thing. The people in Hollywood do that. And then once I started getting my treatments, I was like, oh my gosh, if I am enjoying this and liking what I'm seeing, how can I help other women feel better about themselves and bring that to them? So I trained initially with another nurse anesthetist, Kelly Hermans, who has a med spa in Rochester Hills, Michigan. And that was in 2020 when I did my initial training with her. And since then, it's just kind of been building a little and little. I've done lots of trainings. I've gone back and trained with her. I've trained with with Rana. I've trained with Danny of Pur Aesthetics, Nicola Lowry. I truly have just immersed myself in all of this training that you can do, because the field is so expansive and constantly evolving. So I think it's really important to stay up on that. So once I started in 2020, Sam is our medical director, and we've just kind of grown as the need has grown. So I have another nurse anesthetist that injects with me. I have 2 nurse practitioners, an esthetician, and some front desk staff. So we've just kind of grown as our needs have grown. So just over time.
Yeah. And I think it's kind of exciting just to look back because, I just remember COVID 2020, a lot of things going, a lot of unknowns, but maybe just tell some of our viewers, where Pur started from, where were you working out of into now where are your headquarters?
Yeah, so we started in a single room in South Bend Orthopedics office. I just was renting a room just little by little. And then we moved into a salon to kind of have access all the time as a single room. And then now we have 1,800 square feet of space. We have 3 treatment rooms, storage, and in a mainstream shopping center. So it's been a really great, just kind of growth. I wanted it to be something that was, I don't want to say stress-free because it's certainly not stress-free, but something that was a little different than doing anesthesia and keeping people alive every day. So I wanted it just to feel more fun, I would say.
Well, that's a really, probably smart and authentic way to kind of grow a business. You kind of, start out really just probably you, which is a lot of stress, and kind of taking that leap of faith and something you're passionate about and kind of letting it slowly grow around your passion and getting more people around you that kind of have the same outlook and, principles, that just will build upon itself. So it's, pretty cool for your journey. And how many, is that a very common path for nurse anesthetists? I mean, a lot of nurses do injectables, but not a lot of them go through the anesthesia kind of training first.
Yeah, I would say that since Kelly started her program, there's been a lot of us that have gotten into it. It's kind of like a whole, I don't want to say it's a cult, but it's like a whole group and a whole just kind of community that we all, support each other and, have discussions, and you create friendships. And through that community, you have other people who have the same struggles as you, as business owners or as injectors, and you're able to have that to build off of that and to really help each other. So it's a really great thing that she has made, and that I'm very fortunate to be a part of, and also for the friendships and the colleague relationships that I have built through that, because it's hard starting something new and going to these trainings and really trying to better yourself if you don't have other people to kind of bounce ideas off of, or, what are you doing for XYZ, and how are you trying to be better for your patients in this technique, or, just those kinds of technique-based things for, that we try as medical professionals to be better for our patients. So it's really nice.
I think it's always great when, different practices, small communities, in the Milwaukee area, a lot of the nurse injectors, a lot of them have their own spas, but they're all kind of talking amongst themselves, kind of, being supportive, I think, which is great, not trying to be competitive and, elbow each other out of the space or be the only person there. But it's a big space. A lot of people can practice it, and you want everyone to do well. So that's pretty cool.
Yeah, absolutely. And ultimately, we're all trying to do what's best for our patients, or at least I would hope so. I mean, that's how our practice is built. And there's going to be some time, you do things statistically enough where you need some assistance with something, and, the person next door is going to be who is going to helping you. So it's really great that, I do think that's important to have a sense of community and, helping each other.
And looking at your background as a CRNA, nurse anesthetist, how do you feel like those skills, such as like placing IVs, intubating, keeping people asleep, waking them up, dealing with ICU patients in the past, critically, challenging issues, stressful situations, how do you think that transitions into the aesthetic industry as far as the treatments that you offer over at Pur?
Sure. So I truly think that anybody can be great at a skill if they are going to, immerse themselves and really study it. And that's what they're really passionate about, and just kind of dive deep. I do think that, given my previous history of critical thinking and basically like I'm it when I'm doing anesthesia, because I practice, fairly independently. So I need to have the answers for whatever comes up, whatever issue comes up, whether that's good, bad, I need to have that breadth of knowledge to problem solve. And so I truly feel like in our practice, that's how all of myself and all of my injectors practice, is that we need to be able to solve the problems and to work with our patients to, kind of work on things with them. I think I'm really great at needlework, and that just having that background where I've been poking people for probably 20 years. So I'm super comfortable with that. And then also with the advent of ultrasound guided injections or ultrasound guided thread placements, we have an ultrasound in our practice that we utilize very regularly for placing threads, making sure we're in the correct plane, or for scanning blood vessels, whether that's arteries or veins, and injecting certain areas that are, higher risk, like temples. I'm very well versed in utilizing that and identifying structures. So I think that does give us a little bit of an edge on that.
I think it's interesting for our listeners to know that you're still actively working as a CRNA too, just to maintain your credentials and licensure. So it's almost like you have two full-time jobs. You're still a CRNA, but you also have this robust med spa practice, right?
Yeah. So I do anesthesia, I would say, 4 to 6, 7, 8 times a month. And then I'm at the office the rest of the time. My staff is just phenomenal, and I don't have enough good things to say about them. So they truly are, what enables me to be able to do that. We all have other things that we're doing. Like I have we have other nurse anesthetists, and then my NPs, one is in pulmonary, one is in ortho. So we all have like other things that we enjoy, but we're also able to bring that aspect into our practice. Very regularly I have patients who come in and, they're new in town and they need to set up care. So we're able to kind of dive into our, pockets and our knowledge of the medical community and give them recommendations. So it's fun, and it's a very interesting, how everything kind of comes together in full circle.
Yeah, it's great to hear the personal story behind small business owners, and the struggles and the stressors and the way that you overcome. And just knowing your husband personally, I know that the struggles that you have to overcome. No, I'm kidding. Ryan is a good friend in my fantasy football league, and is an extraordinary CRNA and pain specialist. I just had to throw a little dig at him. So let's shift gears. Let's get into the sciences of the med spas, the different treatments and stuff. Can you go down maybe a quick laundry list of just some of the treatments and some of the procedures, the options that someone can obtain over at Pur Aesthetics?
Sure. So we are a very full service med spa. We have our esthetician who does our medical grade facials, our dermaplaning, and then we can kind of move into chemical peels, microneedling, obviously neuromodulators and fillers, biostimulators, the injectable realm. We have those as well. We have multiple different lasers and platforms. So we do everything from laser hair removal to resurfacing to hyperpigmentation, melasma care, rosacea. We have an acne program for anybody who has kind of played with acne, and some of our younger teen patients. That was also kind of built out of personal experience as well. And all the way up to microneedling, radiofrequency microneedling. We have a pico laser, so tattoo removal. I don't remember if I said laser hair removal, to resurfacing for texture. And of course, medical grade skincare. So we kind of have a little bit of everything for everyone.
Have you caught on to this trend or heard of the trend of the salmon sperm facials? Is that a thing? Do you offer it? Is it going to stick around?
Yeah, so we do have a product, Lumenvi from PDO, that is a PDRN product. It also has a niacinamide, glutathione, vitamin C in it as well. So in the protocol for that, it is to repeat every 4 weeks. So it's interesting. I think the whole PDRN is an interesting additive and something coming up. It has been used in wound healing before coming to cosmetic market. So I think that's really interesting. So I don't know. It'll be.
What does PDRN stand for?
So, I had a feeling you're going to ask me this. It's polydioxide.
But that's kind of the equivalent of salmon sperm. Is that the more appropriate name for it?
Yes. Yeah. It's the polydioxide nucleotide. So it's a DNA derivative, and it helps with collagen restoration, angiogenesis, so creating new blood vessels, and just really skin rejuvenation of tissue. So it's really like, how is it applied? So in a cosmetic med spa fashion, we're just applying it topically. But in a medical fashion, it can be injected if it's therapeutic.
So are patients coming in asking for it because they heard that one of the Kardashians had it? Or are you assessing a patient in the office being like, oh gosh, salmon sperm would look so good on you? Like what does that look like?
So we haven't had a ton of people coming in and asking for it. We've been kind of experimenting with it. Like, is this going to be something that we're going to find to be efficacious? So that's kind of how I run our practice, is kind of like a wait and see type thing. So I kind of let everybody, as the nation as a whole, or whoever wants to be, first to the gates, run out and try it out and test it out and see how it's going to work before bringing it into our practice. Because ultimately, I don't want to be trying to get patients to do something and then kind of fall back on what I said it was going to do. So I would like to have a lot of widespread experience from other providers saying, yes, this is going to work, or that didn't work so well.
So I think that's a smart approach. There's companies are always kind of throwing out new devices that, get approval, and new treatments, injectables, and it's like they seem really great and they sell them really great, and then like a few years later, like it wasn't actually that great.
Yeah,
so watching and learning a little bit first is always smart.
Yeah, exactly.
Yeah, Dan and I were just talking on a previous podcast about not wanting our patients to be guinea pigs, and then a year from now pulling out or removing something that we said was going to offer them the moon and the stars, and so it seems like that's true in the med spa as well. Another trending topic that we're seeing over and over again in pop culture, social media, celebrity news, is this question about fillers. And not only who's getting fillers, who's not, but what really happens to fillers long term, because a majority of fillers are based on our own chemical makeup, and they last for a period of maybe 8 months to a year. Some of them are longer lasting, can get 2 or 3 years, which can be more expensive. But now there's this controversy as are fillers really dissolving? Are they migrating around the face? Are they causing reactions and causing more long-term harm? As many celebrity and gossip magazines are questioning how celebrities are looking over time, and whether this is the result of like a long-term filler deformity. What are your thoughts, I guess, essentially on maybe just fillers in general? Maybe you can just give a basic 101 to our listeners who are not familiar, never been to a med spa, never had a filler, what a filler can do, and then maybe your own personal opinion. We won't hold it up to the law or anything, but what's your personal take on fillers lasting forever or causing migrational harm around the face, and are you yay or nay on that controversy?
Yeah, for sure. So they're fillers in general. One of the major classes are hyaluronic acid based fillers. And so in our body, naturally, one of the major building blocks of our skin is hyaluronic acid. So that is one of the major ingredients of a filler. It's kind of like a sugar gel. So they each have different properties associated with them. How big the molecule is, how stretchy it is, how robust it is. Does it hold its shape? Is it really flexible? So we have an array of fillers that we can choose from. Obviously there are lots of different manufacturers of those. And so we use them, at least in our practice, for volume replacement of those deep and superficial fat pads that have lost volume over time. So in our face, through the normal aging process, one of the things that happens is we lose volume in our fat pads, and that just happens. Did you ask me about Ozempic face? That was one of the questions, or just fillers in general?
Well, yeah, I mean, we had talked offline about
6-point question. You can keep track of all of that.
Yeah. 2B part 4 of the question was, we had answered last season about Ozempic face, and essentially, we sort of debunked the myth that, Ozempic isn't causing destruction of the face. Is simply the changes of weight loss, because just as you mentioned, over time and with age becomes fatty loss, and with that descent of some of the tissues. And so we were seeing Ozempic face more of patients just losing weight in general, including their faces. And then I had curbed this question to you as far as like fillers. Okay, they're using that to replace the fat loss, but what actually happens to the fillers over time?
Yes. So
which was also a complicated question.
Yeah. So manufacturers will tell us that filler lasts about a year, right? When we inject it, our normal hyaluronidase is going to metabolize that over time. Do I think it lasts longer than a year? I think our metabolism of products is going to also be based a little bit on our natural metabolism as well. So kind of what I tell our patients is, if you're someone who CrossFits 7 times a week, you are going to run through everything faster. You're going to run through your calories faster. You're going to run through your tox faster. You're going to run through your filler faster. And if you're someone who does not, you're probably going to have not as high of a metabolism. Does everyone fit in that dichotomy? No. But in general, that's what I kind of try and tell people. I do think, and there is literature to support that there is hyaluronic acid filler that is hanging around for a lot longer. I personally have dissolved tear trough filler that was placed 5 years prior, and the patient didn't have repeat treatment since then. And it was causing, malar edema and issues over time. So I do think that we don't quite understand exactly how long it hangs around. I don't think that we understand exactly why some people metabolize it faster than others. But I think it doesn't really fit exactly into, it's there for a year and then it's gone. So that's kind of what I think. And in terms of, filler use over time, even in the short, I don't want to say short, but even in the 4 years that I've been practicing, I feel like we have seen less utilization of a hyaluronic acid based filler and more awareness of the pillow face trend, where people are very wary of filler in general. We do use a lot of biostimulators in our practice as well. So I think that that's another option for people to kind of give that this slow, natural restoration over time. But I do think there is a place for hyaluronic acid-based fillers, especially if they're used not necessarily to augment what we have as much as kind of restore volume that has been lost. I mean, I personally have probably like 10 syringes of filler in my face, but I don't think that it has been placed in an unnatural way. It's really just to kind of restore and rejuvenate, rebalance my face when I, lose volume in certain places. So, and that's kind of how we approach patients in our practice as well. It's not always to augment, the high points of our face, our cheekbones or our jawline, but we have to kind of glaze those transitions and make it aesthetically pleasing and make you look natural and help just look restored over time.
That's a great answer to a very complex question. And yeah, I think that teardrop area, the lower lids in general, is kind of a different beast in a lot of ways. Mm-hmm. Definitely a trickier place for injectables. Trying to break it down to a little more simplistic. Like what is like the right age to start Botox? Like a younger patient, like should you start getting Botox in your 20s? Is there a number for it, or do you kind of think it's prophylactic Botox? What are your thoughts on kind of younger patients getting some of these treatments early on?
Yeah. So I started getting tox when I was 36 or 37, somewhere in there. And I did have, I had lines on my forehead that were static. I had, my 11 lines that were static as well. And I don't have them now, but I've done all the things, right? So I do tox regularly. I do medical grade skincare. I do microneedling. I do lasers. I do all the things. So it's easier to maintain if you're not forming them first. So those, fine lines and wrinkles are formed by movement of our muscles over time and the creasing of the skin. If we're not creasing the skin, then those wrinkles are going to take a lot longer to form. So we do have patients who come in that, are in their late 20s, early 30s, and start getting their tox even before they have those static lines, or they just have, just lightly etched in lines. And I think that's the right age to start that if you're going to be prophylactic about your treatment. As with everybody, I tell them like the most important thing that you can do for yourself and for your skincare is going to be skincare itself. A high quality SPF, a retinol, a vitamin C, protecting your skin and rejuvenating.
Yeah, I think that preventative kind of strategy is often overlooked. Like, I think the younger generation is like catching on to that, but so often, someone comes in 55 and everyone's sunscreen and they need a, full facelift, a full deep laser resurfacing.
Absolutely.
Smaller investments over 30 years can really prevent the need for a lot of that.
Absolutely. I 100% agree.
Yeah, I think we're seeing, numbers trend down as far as facelifts, or that's the expectation over time, because if you're doing this maintenance, you're doing this preventative treatment, a lot of those major undertakings can be avoided just by preventing the wrinkles from forming in the first place. I think there's a lot of good evidence behind that. It certainly, can be an expensive, treatment program, but, if you're thinking about the number of dollars spent on a facelift, that can be proven to be a cost-effective way, especially as never having wrinkles or, having to fight those. That's a great win for the younger patients that come in. Another common issue that I think med spas deal with, and I think that's just across the nation, is just the jowls, the neck. People just hate laxity of their neck skin and the wrinkles that are on their neck. And, whether it's from COVID and having more of these sort of Zoom meetings and just kind of staring at their necks and stuff, I feel like everyone's just very aware of that. What are some treatment options for patients who just say, like, I feel like a turkey, I got this stuff on my neck over at Pur?
So that is definitely an area that we have a lot of patients come in all the time, and they're like, "Oh, I hate my jowls." I mean, I myself hate my jowls, but I just don't make the faces that show them more, right? But for neck specifically, I really, really love Radiesse hyperdiluted in there. A number of sessions with that. I think it's a great biostimulator. You're stimulating your collagen elastin in a biosimilar way. So I think it's a really great treatment. Also looking at, do we need to do like a tox lift, treat your platysmal bands? Do we need to treat along your jawline with tox as well to kind of relax those platysmal muscles that just kind of lay over top there? Do we need to be doing some laser treatments? Do we need to be stimulating collagen elastin? We can do a thread lift here. Jowls are kind of tough to treat because a lot of times they're the symptom, they're not the problem, right? You're getting these jowls because you're getting this descent, this down and forward transition of tissues over time. So whenever I have a new patient come in, and we always talk about how we want to be treating that patient. So we want to be treating from outside in and top to bottom. So these issues that you're seeing down this lower face, I really want to address what is going on above that, and how do we make this a nice natural transition over time that is going to give you the best result. I do think there's a great place for facelifts. Nothing that I'm going to do in the office is going to give patients facelift results. And I'm very open about that. And, we have that conversation right off the bat. Like, if this is something that you are, even thinking about, go have a consultation, go talk to a surgeon who is an expert in that and can give you all of the right answers, because I am not that person. I am an expert at med spas and what we do here, but that's outside of my realm of expertise. So when patients come in and they're like, "Oh, I want this," like, there's nothing I'm going to do to get that. Same with like a brow lift. If I'm like, I want my brow up here, there's nothing that I can do. I can help relieve some of that pressure with some strategically placed tox. Maybe we can do a brow thread lift for a couple months and give you some relief, but I'm not going to permanently get your brow to stay up here.
Yeah, and I think you hit on some good points where, going back to what Sam mentioned about kind of the pillow or filled face, people were often trying to do these liquid facelifts by overfilling here to lift up, and it kind of made people look weird. So kind of knowing that threshold of what they're really looking for, surgery is a very powerful tool. Not everyone's willing to do it. You have to understand that too, but understand that is an option. If you don't have that tool in your toolbox, knowing when to refer it and having those referral patterns is really important as well.
Yeah. And kind of how you were saying about filling, are we using filler as a filler, or are we using filler trying to lift? Because they don't do the same thing. And so I really try and get down to the why we're seeing what we're seeing and how are we going to fix that? Because if you have the why, it's really easy to know the treatment. If you have the diagnosis, it's really easy to move right into what we're going to do to fix that.
You mentioned a lot of kind of combination treatments. Do you find that you're kind of utilizing things together in a synergistic approach? And do you have a favorite combination you like to do together?
Yeah, we definitely do a lot of stacking of procedures, either same day or alternation, a couple weeks apart. So some of our favorite treatments, and there's literature to support, this as well, where you're pairing, your radius biostimulators and energy, you get more of a result through that same day treatment. So some of our radiofrequency microneedling or our pico laser for our pigment and skin rejuvenation. We have an Aerolace Neo, which is a fantastic laser as well. So those are kind of some of our favorite things to like pair together, and our erbium for some resurfacing for textural issues. We do a lot of like same day stacking for that reason. And also it becomes a little bit easier for people to fit in if they're going to have a little bit of downtime. You just do 2 at one time and you don't have to find more time in your life to kind of have additional downtime.
Our last conversation just about fillers and jowls and brow lifts and trying not to, provide a in-office facelift, that's a liquid facelift that's just not going to last or be just as expensive without the long-term results. To me, that reminds me a lot about our liposuction consultations, Dan, where patients come in and they want lipo, and you can certainly do lipo, but they're expecting or wanting the lipo to also lift their skin and tighten this and pull it in this direction. And that's just where, you want to have happy patients. You need to set expectations. You say, that's just not the right procedure. Or I can't deliver those results for you. And it's happening in med spas just as much as it's happening in our offices. Another topic or treatment, like you just mentioned, is all of these lasers. And a lot of our listeners are not familiar with what lasers can do, or I think at least have this background thought that, okay, someone's going to laser my face, I'm probably going to look like I was sunburnt, I was red, I can only do it in the winter, I need to take off work. Like, is that what is still going on with lasers, or what are some of the newer technologies that are exciting to offer patients with the minimal downtime?
Yeah, so in our office, we have multiple lasers. So we can treat every skin tone from a Fitzpatrick 1, which is super light, all the way to a Fitzpatrick 6, which is a super dark complexion, and all sorts of ethnic backgrounds. There's no limitation on what we can do in our office. And that's because we have an array of those laser technologies. So ultimately, what I tell everybody is that it doesn't matter what name is on the laser. You need to understand, or your practitioner needs to understand, how that energy, when applied to your skin, what it's going to be doing. What is that laser looking for? Is it looking for reds and hemoglobin? Is it looking for browns and melanin? Is it looking for water? What are the expected results of that? So we have lasers in our office that have absolutely no downtime. They have no sun restriction, and that's because of how fast the laser energy is applied to the skin and how fast it's out. So it's below that, thermal relaxation time of surrounding tissue. So it's below that threshold of where you could have an injury to your skin if there's too much melanin or too much sun exposure to that. Obviously, if someone has sunburned skin or windburned skin, we're going to turn them away for treatment because we don't want to be augmenting any issues at that time. But with that particular laser, we run it all year long. You just can't have an artificial tan, so like sun tanning drops or sunless tanner, but a natural tan is fine. A lot of our other lasers, we do have some sun restrictions with those, and that is just because that laser energy is not applied as fast to the skin. It's going to be more of a longer energy pulse. So some of them are going to be ablative. You're going to, look like you're sunburned for a couple days, but some are just completely pain-free. You're just be warm. I mean, I have patients that literally fall asleep while I'm lasering them, and then they're just on their way, and it doesn't look like anything.
And so if I had a tattoo that I regret, I can just go in there, be pain-free with a single session and be done with it? Or how does like a tattoo laser removal work? Like what goes on in that?
Sure. So tattoo specifically is going to be a special subset of laser energy that's going to be applied to that. So Pain-free, I wouldn't say necessarily. We do use either topical numbing or some injected numbing right below the surface of the skin to make it be nice and comfortable. What the laser does with tattoo ink specifically is that it's going to break apart those ink molecules, and then your body is going to help clear out those ink molecules over time. So the normal time frame between tattoo sessions is going to be about 8 weeks. And we use a specific scale that kind of gives us a guide to how often someone is going to, or how many sessions someone's going to need for removal of that tattoo. What color is the ink? Was it professional? Was it amateur? How old is it? Was it ever touched up? What is the person's skin tone? Is there scarring underneath that tattoo? So all of these things kind of come into play when we're trying to tell someone, well, you're going to need 8 sessions or you're going to need 12 sessions of this tattoo removal. And it's always kind of a guide, an approximation, because every tattoo removes very differently.
One of my favorite things is removing a full tattoo during a tummy tuck, assuming they want it gone. It's always a nice
that
freebie.
Would be very satisfying. Then that's a one and done.
Yeah. You mentioned kind of like some discomfort and people falling asleep during your procedures. Are there we had a whole talk about, different anesthesia methods, topical and whatnot. Are there certain things you do in the office to kind of help, decrease the pain of some of the injections or lasers or whatnot?
Yeah. So we have topical numbing. We can also do nerve blocks and injected numbing for that as well. And then we also have Pronox or nitrous oxide in our office. Truly, most of our patients have no problem getting through procedures with just topical numbing. It just takes time. You have to give it time and know what you're doing with that as well.
Taking a step back after you've just gone through the gauntlet of asking us a lot of plastic surgery questions and as they relate to med spa, like what do you think is the hardest part of your job as a med spa owner? Like, is there a specific procedure? Is it the business side? Is it the marketing? Is it the organization? Is it the EMR? Like, what is the biggest strife for us that can get this look in behind the scenes, raising the stage and the curtain to see what's going on behind the engine? Like what's your biggest stressor? What's the hardest part of being a med spa owner?
So I would say like the hardest part is a collective all of it. I am working all the time, whether it's managing staff or patients or answering questions or ordering or entering things into our EMR. It's nonstop. If I had to pick one of those things for me personally, it's the social media aspect of it, which is why I have a team that does it, because I am not technologically savvy in my personal life. I'm not super into making TikToks and Instagram and Facebook and all these things. So it just is not, it's not innate for me to do. I do really enjoy the leadership aspect of owning the med spa. And so I'm starting to take a little bit of a step back from seeing patients. I still see patients 3 days a week, but starting to work more towards doing more leadership and administrative roles and how to really guide and grow our team.
Yeah, I think being a small business owner, any business owner, you're kind of constantly working. Obviously, you have the struggles of day in, day out, but then it's big picture things. And speaking of, big picture, like what do you see for the future of not only Pur Aesthetics, but med spas in general? They're going to continue to expand, and we feel like they're kind of popping up all over the place. You think there's going to be a contraction at all, or what are your thoughts on the future of the industry? And what are you doing next?
Yeah, so I'm not going to say exactly what I'm doing next, but I have a plan.
Of course.
What I want for our practice specifically is I want to be able to care for patients as a whole. I want to be able to be the answer to whatever their aesthetic or wellness need is, just because as we grow and as we learn more about our faces and these treatments and how they are interacting with, our bodies and our aging process as a whole, we're really finding that a lot of it is very intertwined. So I want to be able to help guide our patients through that from the very best way that we can. So that's for our practice where I see that going, and more of a regenerative aspect. And, like you said, we're I feel like we're stepping away, at least from fillers specifically in our practice, but how can we regenerate people's tissues, and how can we give them nice natural results over time so that they feel really great about themselves and are trying to not encounter some of those, issues that we've talked about previously. So that's kind of what I see for our practice. And I think that's going to be happening as a whole in our medicine. I think in our practice, I think there is a place for tox, there is a place for filler, there's a place for all of these treatment modalities. It's just how are they applied to the patient? And like in our market, what I think is really special about our practice is that we are all of our injectors are advanced practice nurses. The master's degree is the minimum certification or educational level that we have. We're not a chain, and we train a lot. We train a lot every single year. And that's really important to us as a practice, not only myself, but also to my practitioners. And so we're always trying to be better than what we were yesterday. And that's not just for us, but it's for our patients as well.
That was well said. You are officially off the hot seat. We've grilled you for over a half hour and you withstood the hot and fiery temperatures. Megan Hagley of Pur Aesthetics, thank you for joining us on the Fuller Butz Podcast. To review, we went over a lot of stuff. We talked about your initial start at the time of COVID and, working out of a smaller office to having, a very nice location right at the heart of a busy section of community. We've talked to you about salmon sperm, about jowls and necks, kind of went through the different treatments that you offer, ranging from the wide variety of lasers that can have minimal downtime to laser removal, hair removal, still offering the toxin fillers that most med spas do, but also offering pain relieving measures to do that, whether it's topicals, locals, gases, and really treating each patient individually, based on their needs and really, as you in your own words said, from the top down, from the outside in, and really, stacking your treatments to allow them all to work synergistically with that. So I think you debunked a lot of myths. I think you made med spas more of something for everybody rather than it's just for an elite person who is already beautiful and needs to look more beautiful, sort of thing. And I think that there's different treatments that people don't realize that they can have at prices that are not outrageous. Megan, is there anything I missed about our podcast?
No, I think that's great.
Awesome. Well, yeah, thanks for joining us on the Fuller Butz Podcast, behind the scenes look at plastic surgery. Hopefully we'll get this out relatively soonish, and we'll put up some links and whatnot to your spot, maybe help the social media stuff that not everyone likes to do as much as Dr. Fuller over there. And yeah, have a good night. Great talk.
Thanks. Bye, guys.
Bye.
Bye. Thank you. Take care.
Thanks.
Thanks so much for tuning into this week's episode of Fuller Butz, a behind-the-scenes plastic surgery podcast. Doctors Fuller and Butz are so appreciative of your time and attention. We invite you to subscribe, share, and continue to enjoy our plastic surgery perspective. Feel free to reach out on Instagram at either @FullerSurgeryMD or @DanielButzMD. That's Butz with a Z for comments, suggestions, and support. Remember, be artsy, stay scientific, and make life fun. We hope you'll join us again on the next episode of Fuller Butz.